Well, I want to title this video a possible way to avoid bypass heart surgery. Now, that is something that you're not going to know you need unless you go to a doctor. You might feel a little bit sluggish, and I know that me putting out the title in this video is going to be, I guess, a bit risk-taking for me, but the reason I want to put it out this way is because I think there's a very strong indication that there has been something that's been known for many, many years that could help you avoid having the need for a bypass surgery. And the secret actually lies in the enzyme that the Japanese silkworm produces. So you might feel a little sluggish like that dog or this cat here, and it could possibly be because you need some bypass heart surgery, but it could be because of your, I don't know, your diet, or maybe you're anemic or whatever. I know there's a lot of complaints about people feeling that it's a common complaint. Sometimes people feel like they lack the energy. There's a lot of different things where they might have a slight blockage. I don't know. I would not be able to diagnose anybody over the internet, and I'm not a doctor. But typically, a lot of times, people when they get older, they require a bypass or a double bypass or a triple bypass or a quadruple bypass, and it involves an operation of the heart. Now, a lot of the times this does occur because there's a buildup on the inside of the arteries and veins everywhere in the body, and it's not just in the heart, but it's across the board. What you can possibly do now, this is a silkworm coming out of its cocoon. What happens is, and you think this is unrelated, but this is something. It's a type of method that Japanese medical researchers and doctors discovered many years ago. And I'm going to tell you a couple other things that Japanese tell their patients, even what they have to by law, that is not common here in the United States. Well, just to give you a little preface of how this works, and it's related to clearing up the arteries and clearing up where you might not need a bypass or preventing the need for a bypass ever occurring. What happens when the Japanese silkworm comes out of the cocoon? It excretes an enzyme that dissolves the cocoon. It dissolves the cocoon, but it does not harm even one living cell. So it only dissolves dead tissue. This enzyme, the Japanese silkworm, excretes. So there's a typical supplement you could take, and you take it on an empty stomach. It's called a serrapeptase. And they do not advertise. Some places do kind of advertise it this way to clear up the arteries and veins. They don't really say, it could possibly, alleviate you from ever needing a bypass operation. They don't say it that strong. But in Japan, it's been shown, and I've read the studies many years ago, because I knew about this for, I don't know, probably a dozen years or more. And I haven't put it out on the internet before, but I don't know if the video's getting any hits anymore or whatever, but I figured I'd put it out here for informational purposes again. But what happened was there was times when people were given this serrapeptase for so many months, and they were scheduled to have a bypass operation, a double bypass or a triple bypass or a quadruple bypass, and everything cleared up because the enzyme was circulating around in the bloodstream, and it was dissolving the built up plaque that was inside the bloodstream, and it was returning the heart to health again. Now, this could possibly be something that can actually maybe increase your energy. That's something, it's a possibility. It's a possibility. But it works a little bit like Roto-Rooter does to when it cleans out the pipes. The enzyme is something like Roto-Rooter or Liquid Plumber. It's safely dissolving any kind of dead plaque that's on the inside of the veins. I know there's other things you could do. You could take vitamin C, NAC, N-acetylcysteine. You can also take vitamin B3, not the pharmaceutical type, but the natural kind, nicotinic acid, niacin. The nicotinic acid, don't take the pharmaceutical brand, but the true nature type, the one that causes the flush. That can help with your arteries and veins too, with the cardiovascular health and heart health. But the serrapeptase is another thing where it's dissolving the plaque that's in the veins. Now, there's other things you could do to help dissolve the homocysteine, like NAC. That's another thing you could take, which is a protein. But just to make it simple, one of the things you could do is this serrapeptase. You want to take it on an empty stomach, though, because the reason being it's a coated tablet, and when you take it on the empty stomach, you don't have as many digestive enzymes in your stomach digesting food. So therefore, the coated tablet, which will be protected from the digestive enzymes in the stomach, will get past the stomach and into the intestines, where it'll be absorbed into the bloodstream intact. So in other words, the Japanese silkworm enzyme will not be destroyed by the stomach acids. Take it on an empty stomach. It's a coated tablet. And then it goes into your pipes, which is the arteries and veins, and it helps, clear them out. It's something that the Japanese tell their patients to do quite a bit. Also, the Japanese who discovered the CoQ10, which is an enzyme, CoQ10, which is sometimes nicknamed the heart vitamin, although it's not a vitamin, but it's so essential to the heart health that that they nickname it the heart vitamin. It's unrelated to this video, but it's related to heart health. It's unrelated to the serrapeptase, but it's related to heart health. I want to throw it in here. This information. CoQ10 is vital to your heart health. The heart actually has the most concentration of CoQ10 in the body. And if you have lower CoQ10 levels in your body, you're at greater risk of heart attack. Well, when you take statin drugs, which are very commonly prescribed in the United States, like Lipitor and Crest, whatever type of statin drugs are available. I don't want to name the names, but I already did, but I don't want to name brand names here. But when you take statin drugs, what it does is it lowers the CoQ10 in your body, which makes your body more susceptible to a heart attack. Now, in Japan, by law, if they give statin drugs to a patient to lower cholesterol, by law, they have to prescribe CoQ10 as a supplement. In the United States, they don't even tell you about this. It's amazing. I don't understand. Well, I'm kind of lost a lot of respect for the medical profession. To tell you the truth, the United States largely, I have lost a lot of respect for the medical profession. But the United States, they won't even tell patients this. So I'm telling you that if you're taking any kind of statin drugs, you probably want to take this supplement CoQ10, because this supplement CoQ10 is being reduced by the statin drugs, and you want to supplement it because the CoQ10 is one of your greatest protectors of the heart, and it's vital for heart health. Now, a lot of people think, I'm going to get on a cardio program, I'm going to go out there and I'm going to, clean out my arteries and veins in my lymph system and clean out all the toxins and trash in my body by doing a lot of cardio, which it does. But if you have blockages, or if you have restricted veins and arteries and restricted aorta or restrictions in your heart, that you got to be careful with this. And if you're, you want to make sure you have good nutrition, good adequate vitamins, the CoQ10, and probably the serrapeptase. It might be a good idea to take the serrapeptase for some time, 30 days before you start on a cardio program, and maybe that'll help clear it out. Now, I'm going to tell you that the prices on this for serrapeptase vary a lot. Sometimes it's because it's of the dosage, and then sometimes it's just because of the brand. It depends. As always, supplements depends on where you buy them. They can vary greatly in price. VitaCost is a good place to buy. I'm not selling for them. I know that the VitaCost is a good one. Swanson Vitamins is a good source. Puritan Pride is a good one. And also the other side of benefit of having more energy, which everybody's interested in increasing their libido and sexual health. It's going to increase that too, because your general health is all related to your sexual health. One way to actually increase the price of vitamins is to take some vitamins that are probably best for sexual health, pre-package them, and say sexual stamina on the outside of the label, and all of a sudden, you can mark up the price by 100% because it's geared towards sexual, stamina or libido. In general, if the more you are improving your general health, the more you're improving your sexual health. That's it. It's all goes together. It's not like one little thing is a magic pill. It's like your general health is all related to your sexual health, and everybody's interested in having better sexual health. Now, as far as again, and I'm not pushing this brand, but it was a good example of the various dosages, and this is why sometimes there are different prices. I'm not familiar with this brand, but I was just showing this because you got 30,000 units, 60,000, 90,000, 120,000. I know, like on Swanson Vitamins, you can get something called serrapeptase, which is really the same thing as the serrapeptase. It has the same serrapeptase in it. It's 20,000 units, and it's $7 for 60 pills, 60-day supply. So if you want to err on the side of caution of taking a lower doses of this, and say 20,000 units is and it's $7 for 2 months supply, whatever. That's off of Swanson Vitamins, called Swanson, and I'm not selling for them. That's what I do. I get that stuff because it's dirt cheap, and it's something that it's not that strong. I'm not, if there's any kind of side effects, which I've never seen any side effects that I know of. It's not a powerful dose. So I can get dosages that are 6 times as strong, 120,000 units and stuff. So I opt for the 20,000 thing, and it's like $7 for a 2 month supply. And I assume it's doing its job where it's, you take it on an empty stomach. So what I do with the pills is I put them in the bathroom in the morning. So that's the first pill I'll take. Because if I mix them up with my other vitamins, I might, in other words, I remember to take it first thing in the morning because it's in the bathroom by the bathroom sink, and there's that pill, and I just take that pill in the morning, the serrapeptase, because you want to take it on an empty stomach first thing in the morning. And then I might wind up taking my other vitamins maybe an hour later. But I assume it's working its magic where it's working like a liquid plumber or a rotor-rooter, cleaning out your arteries and veins. And I got pretty good energy. I mean, I'm going to be drawing Social Security here pretty soon. I'm like, it's amazing. I don't feel like I'm old or nothing. And I don't know what the deal is or what I'm doing exactly, but I feel fine. And I can tell you that, yeah, it might be a lot of different things. Not sure, but this is one of those things that I think it's important for people to know. I'm a little bit afraid to tell people that it's something that, well, I'm not saying it's definitely going to alleviate the need for a bypass operation, but I'll tell you that studies in Japan, and I'm not going to be able to give you a link because I've read this stuff many years ago, and I saw the studies many years ago, doing this from rote memory, but I know there was many, also in Europe too, not just Japan, but not so common in the United States. The United States is all pharmaceutical drugs, the FDA, pay a couple $1,000,000 and what drug can we get in there? This is just a plain old Japanese silkworm that's a coated tablet to get past the digestive acids of the stomach. So that's why you take it on an empty stomach so your stomach acids aren't attacking the pill. And then it gets past the stomach, then it gets into the intestines, and it's absorbed into the bloodstream through the intestines. And then this enzyme does not harm one living cell. It only destroys dead tissue. Now, another side benefit of this also is that it will destroy scar tissue. So it'll eat up scar tissue, dissolve it safely. So sometimes you can have this old injury, and it could be some dead tissue someplace internally. It could be anything. I mean, it could be from an operation. It could be from a sports injury or something. Maybe you got a nagging I don't know, something that was like a scar that's internal and it's bothering you, the serrapeptase can eventually dissolve that scarring on the inside of the body safely. It does not affect one living cell. That's why I say it's a very safe supplement. Um, you know, it's something where I err on the side of caution. I take the lower dosage. I take the one that's 20,000 units. Like I showed you, there's different doses. You get 30,000 units, 60,000 units, 90,000 dosage, 120. I take the one that's 20,000. I get the one from Swanson Vitamins. It's $5.99, $6, and I don't know, maybe there's shipping or something, or I get if you order so many dollars, it's just shipping's free or something, and it works. You know, it works good. It works good. I mean, I can't tell. You know, I don't have, a personal testimony myself, but I do know there have been, medical professionals, not just somebody that's on the outside of the medical community doing a personal testimony, but medical professionals, not in the United States, but in Japan and also in Europe, that have said and have documented where there was patients scheduled for bypass surgery. They took this enzyme for a couple months, and in some cases, the bypass surgery was canceled because the blood flow improved that well. So, I mean, and that's why I'm going to have to title this video what it's about. It's not that I'm going to make a promise to you that this is definitely going to work, but I want people's attention to this, that they understand that there probably is something out there that's dirt cheap that's probably going to cost some people, deprive some people of some serious revenue that do bypass surgeries, which I'm probably going to aggravate the crap out of those type of people, because I'm going to be telling you something that maybe costs $3 a month, $6 for a 60-day supply, that may cause them not to have an operation that on a patient, and they'll lose, how many thousands, tens of thousands of dollars for that, and it might help improve your energy. So anyway, just a quick update on that. It's called serrapeptase. It's the enzyme that's secreted by the Japanese silkworm. The Japanese are the ones that discovered this. They figured, let's put it in a pill, let's coat this tablet so it gets past the stomach acids, so it gets into the bloodstream, and let's see if it clears out the arteries. We know this Japanese silkworm enzyme only destroys dead tissue. It never harms a living cell, and it seems to work very well. It's not something brand new, but it's probably something brand new you never heard of, because I knew about this probably for more than 10 years. I know I've known this for quite some time now. And it's not commonly known in the United States. You can go in your most of your supermarkets in your vitamin aisle, and you're not going to find this stuff. You're not going to find it. You're going to have to order it online. And I tell you what I do. I mean, I get the low dosage. I don't want to take an extreme dosage of anything. I take the lower dosage. It's cheaper, and I remember to take. And I don't take it every single day. Like, I'll take it for a couple months, and then there'll be several months when I don't take it. Then I'll take it for a couple months. I don't take it every day of my life forever and ever. But that's how I'm doing it. I figure it's working its magic. And, it's like maybe it's a problem I won't have that I know. It's like I can't take a twin of me and say, hey, twin, don't you take it, I'll take it, and let's see if you have a heart attack or a stroke or some crap or some kind of blockage, or if you need a bypass. I can't play that kind of game. It's not like I have a perfect science here where I can guarantee your results, because the human body is very complicated, and it's going to vary with amongst a myriad of circumstances. But let me put it to you this way: it's not something brand new. It's been proven in the field, and even though you might say it's a little bit theoretical, I don't think it's that theoretical. I mean, it's very scientific too. Um, this, it's got a lot of validity behind it when you're looking at the logic. It's like a it's like a liquid plumber like this, except the liquid plumber is not hurting the pipes. It's almost analogous to putting vinegar down your drain or something like that, and vinegar is not going to hurt the metal. It's not something real strong. It's like a extremely mild thing that's going to break up bad stuff. And that's really what the Japanese silkworm is. It's enzyme for the Japanese silkworm is. It does not harm one living cell. So when the silkworm is coming out of the cocoon, it's a baby silkworm. It's like, it's very fragile. The enzyme that it secretes, if it was going to kill any living cell, would hurt this fragile silkworm. It doesn't harm one living cell. But it dissolves the cocoon, no problem. So that's what's going through your bloodstream. And then it dissolves also internal scar tissue, which can be causing pain from various injuries. But, I don't think I'm not 100% familiar with what all doctors know in this country, but I know this is not one of those pharmaceutical things out there because it's too cheap. It's way too cheap. It can't be patented. It's ridiculously cheap. And I can tell you other things like if you have aches and pains, and say you got arthritic problems, and maybe that's from scar tissue or whatever it is, and maybe from lack of blood flow. I'll tell you something else. If you take a combination of Arnica montana cream and DMSO cream, you'll see like a miracle overnight. That'll beat anything you can get at the pharmaceutical store by miles. Arnica montana cream combined with DMSO, 70% DMSO cream gel. Mix those two together, put them on clean skin. First the Arnica montana, followed by the DMSO. And if you got pain from joint pain, from arthritis, instant relief. You won't see any doctor tell you that either. I'm not a doctor, okay? But I do know my stuff. But I almost hate putting out these videos because I'm going to piss off some people because I'm going to, if it gets around, it's going to deprive them of a lot of money. And I'm not pitching for this Enerex. I mean, this brand sounds like, I didn't even heard of it, but it sounds a little like Energy. And I guess, let me put it this way. If it clears out your veins and arteries and makes your heart healthier and free-flowing, your aorta's all clean and all that, you don't need a bypass, you're going to have more energy. So maybe that's a play off that name. Now, it's probably not a claim they're not making. And I notice pretty much everybody that sells this stuff won't tell you what it does. They kind of really beat around the bush what it does. So when people are looking at these supplements on websites, they don't really know what the hell it does. And I'm telling you what it does. So, anyway. And that's something you want to be very careful about because, if you think that you're just going to go out there and cardio, that could be dangerous. You want to make sure everything's clear. Good vitamin C for good, strong tissues. The NAC to clean out the homocysteine. Also, nicotinic acid, which is the true vitamin B3 niacin. Several things that are good for the heart, and also the CoQ10. You want to be careful. But you don't want to have any blockages. And sometimes you get these blockages no matter what. And, to me, the best solution out there to get rid of these blockages is this serrapeptase. Now, like I said, the one I was talking about from Swanson Vitamins is called the cheaper one for $6 for 2 months supply for 20,000 units per day. That's a lower dosage. That's called Serrazymes. That's what I get. I'm not selling for them. There's no link. You just have to Google it or some crap. And I'm not getting no kickbacks on this garbage. I'm just telling you some information. But people don't notice. People generally don't notice. I don't even think the doctors know this stuff. The Japanese doctors and some of the European doctors, they know about this stuff. I don't think the American doctors, unfortunately, the United States is so geared towards money, 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 and maybe this is the other side of it too. You don't want people living too long because you're going to have to pay them pensions, you're going to have to pay them Social Security, whatever. You know what I'm saying? So maybe they don't want people around. That's another thing. So maybe if your heart is going to be nice and healthy and you're going to live long and all this kind of garbage and you're going to be very productive. Well, this is another. I'm going to just go on a little further with this because I want to tell you something here. There's a whole other side to longevity that, and it's just my personal philosophy. I personally can't stand people that retire and they just go out there and hit a little white ball around on a golf course and they go to restaurants and they play games with their grandkids and they don't do anything. I look at it like this. It took you so long to get a good education, whether it was up to age 18 or age 22 or age 26. Then it took you so long to be in the workforce to get very skilled at what you do. And it might be 35 or 40 years old where you really hit your stride. And then by the time you're really, clicking, maybe it might be in the 40s or 50s. And then by the time you're getting in your 60s, you're starting to hit on a downslide and then you retire. Well, if you could be productive and as energetic as you were when you're 25 years old, yet with the knowledge of a 60-year-old or an 80-year-old, but like a 25-year-old, guess what would happen to the GDP of the United States and also the actual benefit to all the community in the United States and throughout the world? It would be astronomically better. Because, I don't believe in retirement, I mean, I'll take Social Security and grab the money to do something with constructive, but I don't believe in retirement. I don't believe in sitting on my ass. So I'm putting out these things where I think that people can be in their 70s, 80s, 90s, 100s, or 150 and really be extremely productive, knowledgeable people that are very, skilled in entrepreneurs in a number of fields that could benefit everybody in the community. That's how I look at it. I don't look at it just sit in your lounge chair and do nothing. I don't look at it like that. Okay? So that's my theory on this, because people, as they get older, they get smarter. It's just that they slow down. You don't want people slowing down to get smarter. You want people that gets older, they're smarter, they got more experience, they're wiser, and you want to keep their energy up. And then that all comes into play in production, in productivity, for not just for themselves, but for everybody else. So that's all part of the game. That's how I look at it. All right. So anyway, over and out.